Welcome, Cindy here from Fitness with Cindy. Today we're going to be talking about trigger finger. Trigger finger is when you go to close and make a fist and open, you get a pop or the finger may actually get stuck. That happens many times due to overuse. For instance, gardening tools, working at the computer, maybe you have a repetitive motion job using your hands, or it could simply be caused by arthritis and the aging process. Your fingers are moved by tendons that kind of glide like pulleys. And if on that tendon you get some scar tissue or a nodule, that's what makes it get stuck. The tendon cannot glide as easily as it should. It can range anywhere from mild to severe pain to try to get that unlocked. So that's what we're going to work on today, some trigger finger release. The first thing we want to try to do is see if we can get some motion in that hand. So we just try to open and close it. However, if you have a finger that's stuck, you know how painful that can be to pop that open. So if it's stuck, and even if it's not, I want you to take, and at the base of those fingers, that's where the nodule or the scar tissue tends to form. So I want you, let's say that's stuck. See if you can put your thumb in there and try to massage that area, trying to break up the inflammation or the nodule a little bit. See if that releases it enough to open and close it. A little pressure on it will help. If that doesn't work, get a towel, a hand towel that's not too thick, and let's say that finger's stuck. I'm going to try to sneak that towel in there and give it some squeezes just to warm it up and to give it some circulation. So I'm simply squeezing it just to get some movement in it. Then I'm going to go back to massaging that base of, let's say I have these two fingers, which are very common for trigger finger. Either one can act up on me. So I feel for that nodule and I start rubbing it in every direction with some good pressure. And you're going to do this for 2 to 3 minutes to see if you can get that hand to open and to loosen it up. Once it's loosened up, you're going to go back to opening and closing it. And mine are snapping a little bit right now. But very important, you want to, once it's open, try to lengthen those fingers, stretch out those tendons in both directions. Some people can even get it in their thumb. So same thing, you're going to stretch it in both directions, pulling out and lengthening and breaking up the scar tissue. If it's a single finger, you're going to do just that finger as well in both directions, front and back, and hold it about 5 seconds. I would do this about 5 times. You don't want to irritate it, yet you want to get some freedom of movement in it. Back and forth, back and forth. Another great one is if you can curl your fingers and open them, then curl to the middle of your hand and open them wide, and then to the bottom of the hand. And mine are snapping as I'm doing this because I'm making them go through the pulleys and release. So at the top of the knuckles, then in the mid hand, and open them wide, and then to the bottom of your hand and open them wide. Then again, stretch them. If it's the thumb, stretch that. And remember, it's going to take a few weeks for that to release up. You need to be patient because it's not going to usually happen in one practice. But if you do this daily, I think you'll find after a week, your hand will have a little more freedom. Another good trick we want to do is find a couple of rubber bands. We're going to strengthen and lengthen those tendons. I want you to put it around your knuckles close to the fingernails. And then I want you to pull that rubber band apart and hold it there. And then release it. This is just going to feel good, strengthening the knuckles, the tendons, and release it. Do 5 to 10 of these. I would say, again, every day. And mostly we have this problem in the morning when we wake up from just stiffness sleeping. So try to remind yourself, though, to do it again later in the day, even if the hand's feeling good. That's probably a great time to do it when you've got a little more range of motion. So you just close it and open it and close it and open it. And then do a little bit of a hold and release and hold. Again, about 5 of these, and release and hold. I always like to finish with a nice, again, back to massaging. You can see the nodules I have here, front and back. So I tend to do both front and back of that, breaking it up and then stretching it in one direction and then in the other. And open them wide and just finish with a simple hand wash to give them some feeling good moves. You might even work in a little bit of lotion, either pain cream or just an essential oil to that to loosen them up. Some people find they can apply some heat or cold. You'll have to experiment with both. The heat brings the circulation in, and then the cold calms it down. Give it a couple weeks, and then if it doesn't work, you may have to talk to your physician about a cortisone shot just to bring that inflammation down enough so that you can work that hand back to normal. Because we really want to avoid surgery if at all possible. So work on that trigger finger and let me know if it releases after a couple weeks. Here's to feeling good.